We often picture a narcissist as the loudest person in the room, the one who demands attention, brags openly, and belittles anyone who disagrees. That version can be easy to recognize. But what if the entitlement is quiet? What if manipulation hides behind insecurity, victimhood, or carefully controlled cruelty? Narcissistic patterns do not always wear the same face. Welcome back to Narcissistic Abuse Unmasked. Today, we are looking at 3 commonly discussed presentations: overt, covert, and malignant narcissism, and how each can affect the people around them. First, an important distinction. These are descriptive terms, not 3 official diagnoses in the DSM-5. Overt and covert roughly correspond to what clinicians call grandiose and vulnerable narcissistic presentations. They can overlap, and the same person may move between them. Malignant narcissism is a severe theoretical construct, not a formal diagnosis. These labels should help us understand patterns, not diagnose someone from a distance. Let's begin with overt or grandiose narcissism. This is the presentation most people recognize. The person may appear bold, charming, dominant, and extremely confident. They seek admiration openly and want to be seen as exceptional, the smartest, most successful, or most important person in the room. Their entitlement is visible. They may expect special treatment, ignore rules that apply to everyone else, or take credit while shifting blame. When challenged, they can respond with contempt, rage, or an aggressive attempt to regain control. Your feelings may be dismissed because the relationship keeps returning to their image, status, and comfort. In conflict, the goal is often not mutual understanding. It is to win and restore their sense of superiority. Covert or vulnerable narcissism can be much harder to identify. This person may appear shy, anxious, self-deprecating, or deeply insecure. That alone does not make someone narcissistic. Introversion, trauma, depression, and sensitivity are not evidence of narcissism. The concern is a repeated pattern in which vulnerability is paired with entitlement, impaired empathy, and a need to control how others respond. Instead of boasting, the person may seek attention through chronic victimhood, passive aggression, or resentment. They may believe the world has unfairly denied them the recognition they deserve. Even gentle feedback can feel like a personal attack. The harm is often indirect: guilt trips, silent treatment, backhanded comments, playing the martyr, or rewriting events so that you become the offender. Because the behavior is subtle, you may spend years explaining yourself, apologizing for things you did not do, and wondering whether your own perception can be trusted. Finally, malignant narcissism describes a much more severe proposed pattern. Clinical literature associates it with core narcissistic pathology, alongside antisocial behavior, paranoid thinking, aggression, and cruelty that feels justified to the person. Again, this is not a standalone diagnosis, and it should never be used casually. What matters is the behavior. A malignant pattern may involve deliberate humiliation, intimidation, exploitation, coercion, retaliation, and little remorse for the damage caused. The person may treat kindness as weakness and relationships as contests for power. If someone uses threats, stalking, violence, severe coercion, or calculated cruelty, focus on safety rather than finding the perfect label. Seek support from a qualified professional or a trusted local resource, and avoid confronting a dangerous person without a safety plan. Across these presentations, the common thread is not how loud or quiet the person seems. It is the repeated impact of entitlement, empathy problems, exploitation, control, and resistance to accountability. The relationship becomes organized around protecting their self-image, while your needs and reality slowly disappear. You do not need a formal diagnosis to recognize that a pattern is harmful. If a relationship repeatedly leaves you confused, devalued, isolated, or afraid, take that impact seriously. Understanding a pattern does not require tolerating it. Protect your peace, document what you need to remember, and set boundaries that support your safety. If this video helped you put words to a confusing dynamic, please like the video and subscribe to Narcissistic Abuse Unmasked. It helps this information reach more people who may need it. Stay safe, and I'll see you in the next video.